or the top-down view of the wrist, and it's not classic autoimmune, but there has definitely been some destruction. So I'm going to give you two different scenarios, and one's going to be a little weird, where there's a possibility she was born without some of the bones in her wrist. We'll call it agenesis, which is pretty rare, but given her past history, I guess it's possible, because there's some evidence of minor destruction, but usually with immune-mediated disease, it's pretty uniform, where we see all the bones kind of getting chewed up at the same time. Some can be ahead of the others, but there's clearly, like, it's just not there at all.
Yeah.
And it's massively swollen. See this big white bubble?
Yeah.
So we've got significant joint capsule swelling around both right and left. And this one kind of looks...
So that is swelling. It's not that baggy skin that I see.
Yeah. Because you can see where the joint capsule domes that wrist, and then here's the baggy skin too, because you can see the skin go on, but you can see a definite, very white dome centered around those. So they are very, very inflamed, swollen. All right, and now here is the sideways of the left, and again, it doesn't look like classic immune-mediated disease. There's definitely some osteoarthritis. We've got that big dome of swelling, centered right over the joint. In other words, you get away from it, and it's all gone. You still have that baggy, wrinkly skin stuff. But you get this real intense swelling right over the joint. But there's arthritis there, and that's this whole big ridge here on these little bones here. Maybe a little bit of a punked out or lysis here, or loss of bone right here. And then the right looks very similar. Or I'll bring that down again. Not quite as much on top, but this little bone almost looks like it's luxated or popped out of position, and that could be because of erosion of his neighbor here. So, I mean, undoubtedly there's significant loss of bone, but it's not consistent or completely the same as we would see with immune-mediated disease. And again, not having that previous history, it's hard to know. So since we're not going to do like the joint taps and blood work and stuff, what I'll recommend is we treat these like we would treat any dog with osteoarthritis that's clinically bothering them, meaning anti-inflammatories, maybe some tramadol early on just until we get out of that really ouchy phase, and then things like glucosamine, chondroitin, things that have some science behind them, and omega-3 fatty acids. And if there's a nice response and she gets comfortable, well, then we'll just stick with this kind of long-term maintenance program of kind of tried and true joint supplements with little anti-inflammatory here and there if she has a bad day. We'll say so on a bad day, that's kind of your rescue drug, is an anti-inflammatory. If we have little to no response, like she's just getting worse and this isn't working at all, then we'll say, okay, we've really done our best from a managing osteoarthritis standpoint. Now, even though we don't have a definitive diagnosis, we'll try some immunosuppressive therapy. But these radiographs aren't black and white enough where I feel comfortable just saying, okay, we're going to start her on steroids. Okay. They're just not, they're not the classic, but undoubtedly she was, and there are reports, but they're very sporadic, like agenesis, you're born without this bone, call it a birth defect, call it what you will, and maybe now we're just seeing the long-term fallout, we'll say, from that. Or maybe it is immune-mediated and for whatever reason that component of the joint got chewed up early. So it's